Good morning, one and all. Today we are going to continue with the chapter of finance in dental care. Of which the mechanisms of types of payments. They are 1. Private fee for services, post-payment plans, private third-party service plans like commercial insurance companies, non-profit health service corporations, Delta Dental plans, Blue Cross or Blue Shield or the non-profit health service corporations, prepaid group practice, capitation plans, salary and public programs. Coming to the first, that is private fee for service. Private fee for service is a two-party arrangement. It is a traditional form of reimbursement for dental health services. Dentists overwhelmingly prefer to practice under this arrangement, and this is considered as the most effective way of providing dental care. Fee for service is an integral part of private practice as a delivery method. What are the advantages? It is culturally acceptable, and this system is having the flexibility like fees can be changed in accordance with market conditions, and the dentist is also able to practice what is called price discrimination. And the third, it is administratively simple since dentists need not keep a written list of fees for procedures. And fourth, it is the only system under which some form of dental care likely will ever be provided, that is, can be used in expensive situations also. What are the disadvantages? Because major percentage of the population cannot afford this type of dental care where the private fee for service because the prices. In Indian scenario, this is a payment method that is most commonly employed in India, that is, which is a socialist country having the healthcare of its citizens where the lower per capita public expenditures on health is very low because the government spends only around 1.5% of the GDP on healthcare, as 80% of this are on salaries. There is a little for other medical conditions, so there is a difficulty in providing these types of private fee for service. In India it is mostly followed, but the people are not that much affordable. This results in a poor quality of care in most of these government institutions where the patients pushes to the private sector to meet their health needs. Estimates show that around 80% of the outpatients and around 40 to 60% of the inpatients use the private healthcare facilities itself, as these facilities where the patients pay the fees and render the service from their pocket. As the cost of dental care continues to rise, the majority of the people are not able to afford the dental treatment, especially when it is being provided by fee on service basis. Very few people can afford to utilize this service regularly. This places a large burden on the households where especially the poor and indigent cannot afford these services. They are forced to borrow or sell their assets to meet the expenses while going for a service like in the healthcare. Most of the people will visit dentist only for curative service occasionally because preventive measures are too costly. So these current methods of financing in dental healthcare as the fee for private services are clearly unsatisfactory in Indian scenario. Coming to the second one, that is the post-payment plans. It was first started in the late 1930s where the local dental societies of Pennsylvania and Michigan came into existence of providing these post-payment plans. It is post-payment plans or budget plans are mechanisms for the individual's purchase of service where the dentists have frequently arranged to allow the payment for the dental care to be made in intervals over a period of time. Under these budget plans, the patient borrows money from the bank or a finance company to pay the dentist fee. Application that is provided, that is approved by the lending institution, and the dentist is paid the entire fee for the service, then the patient repays the loan to the bank in budget amounts. It is like taking a personal loan where the people first take the loan and pay the dental services, where they are going to pay for the bank or the provider who is given the money. What are the advantages? They are helpful for middle income people, primarily used to finance the prosthetic and other costly treatment. And what are the disadvantages? Lower income people cannot use to the full, and problem of defaulted loans might be occurring in most of the post payment plans or budget plans. In Indian scenario, it is not implemented because of the majority of the are low income people. And the third is the private third party prepayment plans. The definition of the third party private party plans are as payment for service by some agency rather than directly by the beneficiary of those services. So the dentist and the patient are the first and the second parties, and the administrator of the finances is the third party, defined as the party of dental prepayment contract that may collect the premiums, assume the financial risk, pay claims, and provide administrative services. The third party is also known as the carrier, insurer, underwriter, or administrative agent. Usually the term third party refers to the private carrier such as the insurance company. That is, as I said, the first party is the dentist, the second party is the patient, and the third party is the administrator of finance. So the third party, the definition, as I said, the party of the dental prepayment contract and that may collect the premiums, assume the financial risk, pay claims, and provide administrative services. The third party is also known as the insurer, underwriter, or administrative agent. Insurance principles of the dental care. Earlier, dental care was considered as an uninsuranceable by carriers. This reasoning was based on the assumption that their very nature of dental need violated by the basic principles of insurance. That is, to be insurable, a risk must have be precisely definable and be of a sufficient magnitude that if it occurs, it constitutes a major loss, and be infrequent and be of an unwanted nature, be beyond the control of the individual. But in dental, it is difficult of having all these principles, as all the things of the health insurances violates, because every individual can't say that the dental problem might arise at a particular time or a major loss might occur. So insurance companies have found that dental insurance can be more feasible by have patient share of the cost, so limit the range of the service available, and offering services only to groups, including the waiting period after enrollment before benefits become payable, and use pre-authorization and annual expenditure limits. That is how the basic principles and the risk that has been set by the insurance companies. That is, as I said, the basic principles should be precisely definable and be sufficient magnitude, unwanted expenditure like accidents, fire, etc. beyond the control of individual, not constitute of a moral hazard. So the dental insurance made feasible, as I said, that the patient should share the cost, limit the range of services available, offering services only to group, including waiting period before the benefits become payable, use pre-authorization and annual expenditure limits. What are the different ways of insurance carriers works? That is, payments either by deductible, co-insurance, or group insurance. As I said, it is deductible. It is a stipulated flat sum of the patient must pay towards the cost of the treatment before the benefits of the program go into effect. It is sometimes called as front-end payment. That is, we should pay earlier before the problem arises. Second one is co-insurance. It is called as co-payment. It means the patient pays the percentage of the total cost of the treatment. Insurance carries limit of range of healthcare services covered, so the term is limitation of benefits. The name itself said it is co-insurance, that is, part of it is paid by the person. Deductible is different. Deductible is a stipulated flat sum that should be paid by the person. Co-insurance, where certain healthcare services might be paid by the insurance company, remaining amount should be paid by the person who is going to do it. So co-insurance helps in keeping the premiums down. Co-insurance is defined as an amount that is arranged which a carrier or a beneficiary are each liable for a share of the cost of the dental services provided. So, for example, we would like to say that a patient has to pay 20% of the cost of hospital care. The remaining 80% will be paid by the insurance company. That is limitation of benefits. Group insurance. This is a health insurance offered only to groups. This is because of the illness experiences that is reasonably predictable in a group. The probability of adverse selection is also reduced by the use of the waiting periods after the enrollment before any benefits become available. So it is a group insurance where it should be taken into criteria where it might be predictable according to a group. So by this we end this chapter of the second part of the finance in dental care. This is a picture showing the how the insurance payments might be, that is the third party payments. Like the dentist fee, if it is rupees 100, the third party fees will be 80 and the patient will be paying the amount of rupees 20 itself. Thank you.